Welcome to our Family Connection webinar, Military Mental Health Community Resources. My name is Deja, and I am a Family Outreach Representative with the Office of Family and Community Engagement for Virginia Beach City Public Schools. I will be facilitating today's webinar, where we will be learning about a few of our community's mental health resources that are available to meet the unique needs of our military students and families. Please be sure to watch this in its entirety to gain some valuable insight, information, and resources on today's topic. I'd like to take this opportunity to introduce our three panelists. Today we will have Robert McCartney, the Chief Executive Officer for the Barry Robinson Center, Elizabeth Bowman, Community Liaison for Kempsville Behavioral Health Center, and Lindsay Peard, Military Liaison for Virginia Beach Psychiatric. A little bit about our presenters. Robert McCartney is the Chief Executive Officer for the Barry Robinson Center, a behavioral health system in Norfolk, Virginia, anchored by a 72-bed residential treatment center. Over the past 6 years, Rob has led the Barry Robinson Center's residential program's transition from a typical residential treatment center to a premier program whose primary mission is to help military-connected children and their families heal. Since 2013, the Barry Robinson Center has provided care to over 900 military children, adolescents, and their families from over 47 states and 4 countries. Rob will tell you, we don't get it right all the time, but we do get it right most of the time. Just go look at the smiles. Our second presenter, Elizabeth Bowman, is a community liaison with the Kempsville Center for Behavioral Health in Norfolk, Virginia, and a nationally certified child life specialist. As a certified child life specialist, Ms. Bowman spent 18 plus years supporting, advocating, and caring for children and families during emergency room visits, intensive care treatment, and end-of-life medical care. She has worked with patients from members and loved ones navigating new diagnoses, extreme medical emergencies, and one-time medical events. Elizabeth is passionate about children, teens, and their families having access to quality mental health services and knowledge of the community resources available to them. When she is not advocating for children and families, she loves to spend time with her family in Virginia Beach and Elizabeth City, North Carolina. She is especially fond of the fur children that include her German Shepherd and her newly added Golden Doodle. And last but certainly not least, our third panelist is Lindsay Peard, Military Liaison for Virginia Beach Psychiatric Center. A native of Virginia Beach, where she lives with her significant other and 2 rescue dogs, she graduated from Tallwood High School and relocated to Richmond, Virginia to attend VCU. It is here where she earned her bachelor's in science, focused in community health education. Lindsay learned about her love for mental health in 2018, where she worked for a child and adolescent mental health hospital. Since then, Lindsay has been spreading the passion of mental health to everyone she encounters and continues to build resources and relationships for the military families in the Hampton Roads area. I would also like to take the time to thank Ms. Mary Hunt, our Administrative Office Associate from the Office of Family and Community Engagement. We go by the acronym FACE. We'd like to thank her for providing technical assistance and support during our webinar. So today, we will hear a presentation from each panelist about the services their organizations offer to our military students and families. We know that at times life can be hard, and some of life's stressors require a little extra support to get through. Military families, on top of these life stressors, also bring unique experiences and challenges to that mix, needing services and supports from organizations that understand their needs. Today, we will hear from some of these organizations in our community that offer support to our military families. First, we'll start with Lindsay Peard from Virginia Beach Psychiatric. Thank you for being here. Lindsay?
Thank you, Deja, for that great introduction. Hello, everyone. I wanted to first start off by saying that it's okay to not be okay. If you need any mental health, we are the resources to help you, and there are so many more in the community. Please don't ever hesitate to reach out to any of us. Sorry, one second. Okay, so this is Virginia Beach Psychiatric. We're located in Virginia Beach on First Colonial Road, right next to Virginia Beach General Hospital. Don't be confused, we are a different facility from Sentara. Brief overview, we are a 100-bed freestanding acute facility. We have 5 different acute units and a partial hospitalization day program. Our Robert Light is our medical director. Kurt Hooks is our CEO. We work with 18 and up. We're a 24-hour, 7-day-a-week facility. We work with community engagement, the TDO process. We have court proceedings on site, and we accept most private insurances, including TRICARE. We look forward to helping you in any way we can. So to break it down into our different units, we have 5 different units within that 100-bed facility. Each of the units are 3 mental health units and 2 detox units. I won't go into complete detail, but just to give you a brief overview, is that we have a Center for Emotional Recovery as one of our units. This works with patients going through emotional crisis. We also have the Center for Intensive Evaluation and Rapid Stabilization unit. These are units that are designated for acute treatment of patients with emotional disorders, including but not limited to schizophrenia, paranoid disorders, psychiatric disorders, and many more. The reason why we like to highlight that our units is that we have the 3 different mental health units and 2 detox units. It's because we recognize that each patient's going through something different. So with every unit that you're going to be on, your group therapy, your peer therapy, your individual therapy is all going to be different. So for example, if you are going through postpartum and you're having this trouble, we're going to put you on one unit and you're going to be separate from someone that might be going through a detox on opioids. So just know that you're here safe and we're not going to mix you all together into one unit. So the acute focus, what we do here. So we have individual, group, family counseling, problem-solving groups. We're a well-structured, predictable therapeutic environment. We have allied therapists, including art, activity, and recreation therapy, educational groups on various behavioral topics. We have communication groups to help enhance self-esteem, and again, that chemical dependency program. Our detox units, like I said, we have 2 units out of that 5. They're acute, that stay can be about 4 to 10 days. We have 2 units with one is a mental health and a detox. So you're going to be getting that mental health stabilization with the detox at the same time. So your group therapy is going to be a little bit different. We also have a straight detox unit. So you come in, get detox from what's going on. Our partial hospitalization program. This is a great program for a step down and a bridge between acute and then back into your normal therapy program. We offer transportation available in most areas. We are Monday through Friday, 5 hours a day. And then we work on heavy journaling. So you're going to go home, you're going to get exposed to what you got going on, and you're going to heavy journal about it. You're going to come in the next day and we're going to talk about it. Your group therapy is going to be geared to what you got going on with the rest of the group program. The first program is a chemical dependency program. So this is where we're going to focus on that 12-step model. And then the second is a mental health partial program. Again, this is your bridge to go from acute care into a normal therapy program. The assessment and referral process. First, we want to say that we are a 24-hour facility, so we're always here to help. There's someone at the front door to greet you, and there's someone to answer the phone. The master level clinician that's going to answer the phone when you call that 757-627 life number. Anytime that you have a question or you're in a crisis, we want you to call that number. Now, we also recommend that we do work with local ERs. If you're in a serious crisis and you need medical attention, you need to go to your first local ER first and then call us next. We work with over the phone. We start the process. We start the process by getting a quick synopsis of what's going on. And then we do assessment. We make sure that your criteria is matched to come in and we have a bed available for you. Upon that, then we have you come in and we do a in-person level care determination. This is where we break it down and we see if you need to go into a partial program or you need to go into an acute program. We check your current mental examination, we do a safety assessment, and we go with the plan of action. If we're not going to be a fit for you, we're going to provide you those resources to find the fit for you. We also work with a temporary detaining order. So that means that if you need to call CSB or the magistrate, You can go through that process if there is someone that's unsafe or you're unsafe for yourself and you need help. A few questions and answers for you. What do I bring? You're going to be here and you're going to be working on yourself and going through. So we want to make sure that you're going to bring clothing that's comfortable for your 4 to 5 day stay. What substances do we detox from? Alcohol, opioids, and other select drugs. What if you need help in the middle of the night or on the weekend? Like I said before, we're a 24-hour, 7-day-a-week facility. We have someone at the front door to answer any of your questions and someone to answer the phone for you when you call too. What's the average length of stay? 7 to 10 days for acute care. Sometimes you can have a 4 to 10 day for the detox program. Our partial program is a 2 to 3 weeks, but again, that's a Monday through Friday, 9 to 3 program. Can patients receive phone calls or visitors? Absolutely. We certainly encourage this, and we want you to be involved with your spouse's situation and be there for them within therapy. But as a patient, we also have to keep them safe. They're provided a PIN upon intake. If you don't have that PIN or know that PIN, we're not going to be able to allow a phone call or allow visitors. Please call us at that 496-6000 number, and we can give you the specific times and days upon when therapy or when visitors and phone calls are allowed. We want to make sure that the patient's therapy isn't interrupted. So that's why we have strict time frame. Is there follow-up care? Yes. Like I said before, our partial program becomes a bridge between that acute into the next step. And then we also work with you within your first 48 hours of being brought in is to work with the social workers and work on that process to get you an appointment outside after your discharge. We also let you leave with 2 weeks of medication if need be. That way you have enough time to get another appointment, another follow-up to get re-prescribed and med check for you. Do we accept active duty? Yes, we do. The referral process is very different for active duty members versus the dependent side, but we can certainly help with that. We have a great relationship with local bases and Portsmouth Naval that can help with that process. Call us first and we'll be able to help you guide you through. This is Virginia Beach Psych, our website and our number. Again, call us at 757-627-LIFE, which is 5433, if you have any questions or concerns. Deja, thank you so much for having me on today.
Awesome. Thank you so much, Lindsay. That was great information and really great insight to this process and something I think will be helpful for our families. So second, I will turn it over to Elizabeth Bowman from Kempsville Behavioral Health Center. Ms. Bowman?
1 second while I get my slides. Okay. My share screen option has gone away for some reason, so let me work on that. Thank you so much. Again, my name is Elizabeth Bowman. I am one of the community liaisons with the Kempsville Center for Behavioral Health in Norfolk, Virginia. We are located right next door to Centera Lee. We are not affiliated with Centera, but just to give you a good idea of where we're at, we are next door to Centera Lee in Norfolk, Virginia. Kempsville Center for Behavioral Health is a 106-bed hospital. We provide inpatient care for children and teens needing immediate mental health crisis intervention, and that's our acute unit. I'm going to talk about the 3 different units at our facility, which is acute, residential, and partial hospitalization, and this is just a brief overview of each unit. We also provide residential care, which is long-term therapeutic solution to overall emotional wellness. And our partial hospitalization program is an intensive outpatient treatment option. I'd also like you to know that the Kempsville Center is TRICARE certified and works with many families that are connected to the military, both active duty and veteran life. And I think it's important to also know that we look to hire staff members that are military life aware so that we are providing services that are familiar with what the military child and family go through on a daily basis. So All three of our treatment programs are going to be multidisciplinary team focused, and part of that team, there's a big group of us, so that includes the family or guardian, as well as siblings. We want to include the whole family in treatment. We have nurses 24/7. We have daily, weekly group work going on. We have recreation therapy, which includes art and music, so time with our art therapist and our music therapist. We have substance abuse groups, which includes a certified substance abuse counselor, case management, and community support, as well as our psychiatrist and therapist. So to go into a little detail about our all of our units, first I'll talk about our acute crisis stabilization unit. This is for children and teens that are in immediate danger to themselves or others. The behaviors that constitute an acute crisis vary by age, social development, and other factors that a clinician will discuss with each family during the assessment. For this unit, it's for males or females ages 4 years old to 18 years old. For our 18 years old, we want them to be functioning as an adolescent, so still living at home, still answering to mom and dad, still enrolled in school. The average length of stay on the acute unit is about 7 to 10 days, and that'll be based off individual clinical needs. This unit focuses on crisis stabilization in order to discharge to the community providers for long-term care and follow-up. So next I'll talk a little bit about our partial hospitalization program. Similar to what Lindsay mentioned at her facility, this is a day program, and this is for youth struggling to maintain functional family, friend, school, and community relationships that may or may not have already been involved in outpatient therapy. So it's not a requirement that kiddos have already been involved in therapy to participate in our partial hospitalization program. The ages are ages 8 to 18 years old on this unit, and patients will attend Monday through Friday for 8 hours a day. Kiddos will receive 6 hours of clinical groups and services a day, and then 2 hours of academic support, where our teachers from the Kempsville Academy will come over and help the kiddos complete their schoolwork to keep them up to date with what their school is requiring, so that when they return, they're not falling behind. They have weekly individual and family therapy appointments with a psychiatrist, and they will also have time with our substance abuse group or in a substance abuse group with that certified substance abuse therapist if needed. And this can be standalone treatment as a step down from acute or residential. So it can be a standalone treatment or a step down from acute or residential care. Any of those options are fine. Next, our residential treatment program is for those youth who have not been able to meet the goals for functional family, friends, school, and community relationships, including self-care, wellness, and safety of themselves and those around them through outpatient therapy and community-based support. They may or not have been hospitalized for acute stabilization already. So these kiddos have really been, they've been trying therapy, individual, with their family. They've maybe been hospitalized for acute care already. They might have already had intensive in-home therapy, and they're still struggling with a lot of these needs. And so then it becomes time to discuss if residential care is going to be the appropriate next step. And this is a therapeutic living environment focused on long-term clinical goals to infuse positive mental health practices into daily life skills. And the ages on this unit are 11 to 17 years old. The average length of stay on this unit is usually around 6 to 9 months. This can be a little less or a little more, but this is just the average length of stay on our residential treatment program. On our residential treatment program, we have Kempsville Academy, which is a school that is part of our secure building that is fully accredited. So when kids are in residential treatment, they are enrolled in Kempsville Academy. And the nice thing about this is that when they return back to their the school system that they're already part of, their records will show that they were in Kempsville Academy, which doesn't label them as having been in a mental health treatment facility or a residential program. It just shows that they were at Kempsville Academy, and their records will follow them back to the school they return to. They can also participate in substance abuse groups if needed with that certified substance abuse therapist, just so you are aware of that. So things to know: if you think a child or teen is having a mental health crisis, or someone in the child's life has recommended that they get a crisis evaluation, the number that you can call is 757-461-4565. And that number is open 24 hours a day, 7 days a week to receive phone calls. And our lobby is also open 24 hours a day, 7 days a week. We always suggest calling to make an appointment for an assessment, because this does alleviate long wait times, that if we are busy, we'll keep you in a safe place. You are more than welcome in our lobby or a private room if we have it. But if you call the number to make an assessment, it does usually help eliminate that long wait period. But our doors are open 24/7 to walk into as well. Crisis assessments are free. And I think for our military families, what's really important to know as a military spouse myself is that a referral from a PCP, a therapist, a school counselor, or an emergency room is not required. Dependents can call that number for an assessment 24/7, like I said, or walk into our facility. So a referral is not necessary. Like Lindsay said for Kempsville or for Virginia Beach Psych, if you are experiencing a medical and emergency that requires medical immediate care, then we suggest obviously that you go to an emergency room. But beyond that, you are able to walk into our facility or call in to make an assessment 24/7. And you will get master's prepared clinicians to provide a free crisis assessment and work with one of our psychiatrists to determine the next best step for your child or teen. And to find out more, you can visit our website, which we have up on the screen, or call us 24/7 at 757-461-4565. I also included the link. You can find this link on our website, but this is the link for a video that will take you to our director of admissions that goes through important items to bring with you, such as clothes and your insurance card, and what to expect in more detail during that admissions process. So thank you, Deja, again for having me. My name is Elizabeth Bowman. Please call us anytime, even if you just have questions or want advice on what the next best step to make is.
Awesome. Thank you so much, Elizabeth. I feel like it's so helpful to have information on services like this, because when we're in a crisis, it's so hard to know where to start or where to look. So thank you guys so much for bringing these resources to our families. And finally, I'd like to turn it over to Mr. Robert McCartney.
As we shared, I'm Rob McCartney from the Barry Robinson Center. And we are located in Norfolk, Virginia. It seems like everybody's using a Sentara hospital as part of their markers, and we're across the street from Sentara Lee on Kempsville Avenue. Next slide, please. Thank you. As I shared before, the Barry Robinson Center, we are a residential treatment center, and we work exclusively with military families. Over the last probably 4 to 6 years, we have worked with families from 47 different states and 6 different countries. Slide, please. Thank you. Very quickly, some of the key things to know about the Barry Robinson Center is that we're a nonprofit 501c3. As shared before, we're 100% military focused, and length of stay is between 5 to 6 months. Clinical presentations on our kids, we see a lot of anxiety, a lot of depression, a lot of school challenges, a lot of kids who've been diagnosed with PTSD, major depression, and issues of adjustment. As we know, military life can be very challenging. You have multiple PCSing, multiple schools, multiple deployments, and sometimes kids have difficulty navigating that. And sometimes I call it, one PCS too many. And when families start to look for residential programming, they have had a tough road. And we want to make sure that they know there's an opportunity for them to reach out for a program that can help them navigate that. Slide, please. One of the things that we love about the Barry Robinson Center, as some of these pictures can depict, is the campus. It's an open campus. We're on 35 acres. We have a full gym. The dorms that the kids live in look very much like college dorms. We have 6 kids to a pod, 2 to a room. And we also have a lot of different types of therapies, but also treatments. The goal here is to, one, meet the unique needs that kids have clinically. Not every child benefits from traditional talk therapy, but also to offer a breadth of opportunities. So, we have a scouting program. We have music therapy, and that includes a guitar ensemble and our choir, Voices of Pride. We have a fairly robust art program. We have a spiritual life coordinator that helps with that part of an individual's life. We also have access to an equine program where the horses that we work with are horses that have been adopted as well. We do a lot of geographical distance therapy, and by that I mean we do a lot of work virtually. And that has allowed us to work with the folks from 47 different states and 6 different countries. However, for those of you in Virginia Beach, we expect you guys to be on campus as often as you can. We have pet therapy, and you'll see a picture of our dog, Bo, coming up. And we also have a chapel where the residents have the opportunity to attend chapel and also participate in our chapel services. Slide, please. I think it was shared earlier about the importance of education. And the Barry Robinson Center has a very robust education program that's accredited by VASIF. But I think one of the really cool things about the center is that we have 3 different online programs that allow our kids who are maybe taking advanced calculus, French 4, to be able to continue with that level of their schooling. We also have great relationships with both local and national-wide schools. The ratio of our teachers is about 1 to 8. We also have a classroom paraprofessionals that are in there as well. And so it breaks down to about a 1 to 3 ratio. Your child will be in class for about 5.5 hours of classroom instruction a day. We're able to also do a lot of community trips based on the level of safety for the individual. And we also, the school operates 12 months a year. So whenever a child comes in, they can pick up on their program at that time. In addition, we have a full-time PE teacher. And also part of our music program is embedded into our education program. This last summer, again, we had our vegetable garden farm to table curriculum, which last week we actually got to sample some of our wares. Next slide, please. As shared earlier, we have an equine program. During COVID, we actually were able to bring our horses onto campus. Since COVID's been over, we now go out to our partner, which is out in the Pungo area, which is sort of the south part of Virginia Beach. We're out there at least once a week. And that is working with our rec therapist as well as our equine therapist. Next slide, please. Again, talked about music. What we have found over the time is that music can be one of the best healing opportunities for our kids, both with self-expression and as well as being part of a group. As part of Voices of Pride, one of the cool things during our chapel services, they perform. And the amount of pride they have after performance and the applause they get from their peers. And it's often one of the first times in a long time parents get to witness, and yes, parents, you are invited to those services if you want to come, the opportunity to see their child doing something normal. Slide, please. And as I shared, we have our pet therapy dog, that's Bo. Bo just celebrated his 3rd year with us. And Bo is sitting in front of our bell. And the bell is rung at time of graduation. It's one of those big events when somebody is ready to leave, where they come out, their peers are lined up, saying goodbye to them, families there, the therapists are there, and they have the chance to then ring the bell and celebrate their success. Next slide, please. So for contact information, Laura DeSimone is our Regional Director of Military Readiness. You can see her contact information on this slide. She is a military spouse and has been very engaged with our community, both at the military level and the civilian level. Next slide, please. Here's some additional resources. Both Lindsay and Elizabeth were able to share with you their resources, and certainly make sure you have those numbers to reach out. But there's several other resources I think you need to have. One is CHKD, Children's Hospital of King Daughter, and there's their contact information. Military One Source, which I'm sure you are all familiar with, is a great resource to reach out to. The Stephen A. Cohen Military Family Clinic, another nonprofit that's in our community that works with military families, veterans and dependents, is a national organization. They do short-term work. Reach out to them. And also don't forget our 988 Suicide and Crisis Lifeline. If you or a family member is experiencing some suicide thoughts or ideations, please call 988. You also have the National Military Family Association, great resources. And then one that I hope that you're aware of is the Military Child Education Coalition, MCEC. And I know that they're doing some work with Purple Star schools as well. Next slide, please. And finally, this is November as we're talking. I do want to remind everybody, this is Month of the Military Family. I want to thank family members that are serving with our service members and the children of those family members as well. If you have the opportunity to say thank you to another peer, please do so. Next slide, please. And finally, you have my contact information. Every parent who comes on board with us gets my card and has access to my cell number. I encourage folks to, if they think the CEO needs to know something, to let me know. But with that too, one of the pieces of advice I would give you, if you and your family have gotten to the point that you're thinking about residential placement, do your due diligence. Go online, look at reviews, look at the programs, and come visit. If you're thinking about the Barry Robinson Center, drive by, stop by, even stop in and say you want to visit. And you can even say Rob has sent you for that visit. Again, thank you very much for the service, and hope that this information that's been presented today has been helpful. Back to you.
Thank you so much, Rob. That was some really good points that you made, and the services that you provide are so beneficial. Thank you also for having some additional resources and contacts for our families at the end. So I will now turn it back to our panelists. If there are any last minute highlights, additional insights, or last minute information that you would like to provide.
Well, I'll go first then, right? Is that I'm going to reinforce, if the family, if you get to the point where you think you may need residential care, that's a huge decision. Please do your due diligence. Give us a call. We can give you ideas if we're not the right place. There are a lot of residential programs in our country that work with military families. So do your due diligence first. And like I said, come by for a visit. We'd love to have you on campus.
Awesome. Thank you so much.
I 100% echo that. We want you to get the help if you need help, and we really don't really care where you go as long as you're getting what you need. We're here to help support you and answer any of those questions. So if you feel like you just don't know where to start, as Rob said, go ahead and do your research, look online. But if you want to just make a quick phone call, we're here to help and give you those resources of where to go from there. Thank you so much.
Thank you so much. I agree with everything that Rob and Lindsay had to say. And thank you for allowing us to share this. I hope that it is a valuable resource for parents and even students watching, and just so they know places that they can reach out to and have resources. So please don't hesitate to reach out to any of these facilities just for guidance, even on what to do next.
Thank you guys so much. And for our families, this is just a place to start, not an exhaustive list. There are many other resources available as well. But if you ever find yourself in need of any of these services or have questions, this is a good resource and place to begin. So I would like to just wrap up our webinar by saying thank you so much to our panelists for their hard work, their insight, their dedication to our community, and for taking the time to contribute to our military mental health community resources webinar. Special thanks again to the amazing Miss Mary Hunt, our office manager at FACE, who has been helping us traverse any technical difficulties and getting us rolling through this. And yeah, our great support for today's webinar. Thank you all for being here and for watching. Have a great day and take care.